In this segment, we talk about our friend gout. It's a lovely condition that causes severe joint pain and sometimes deformities that can become awful. Say goodbye to your high heels, open sandals, as they're going to become swollen in our adventure into gout. And yes, I did say gout, not to be confused with goat, which is our lovely friend smiling right here. And he'll know he'll never get gout. So goats eat trash and gout is for joints. Anyway, now that I got that cleared up, let's dive into this condition. So what's happening? Gout is the condition of either making too much uric acid or not peeing out enough uric acid. This is the byproduct of a bad diet, usually containing high purine containing substances. What the hell is purines, you ask? Well, this is a chemical compound. Now, I know we're not all organic chemists, but the N stands for nitrogen and the H stands for hydrogen. The lines and double dashes are chemical bonds represented by carbon atoms. So essentially, a high purine diet, usually found in alcohol, meats, shrimp, shellfish, gets converted by the body into uric acid. And it's this uric acid that we naturally urinate out. However, if we eat like trash, our production of uric acid becomes really high. Take, for example, Billy Joe. He loves shrimp so much that he took this photo for all of us to see. Thanks, Billy. I personally feel bad for the shrimp, especially the first one. Poor shrimp, first cooked, and now his dead body is being fondled by the fat man's tongue. Feel bad for you. If you were to drain some of this fluid in the affected joint, you would get uric acid crystals. These crystals look like little toothpicks at a microscopic level, and they are sharp. They cause bone deformities, get into the joint space, and make the joint swollen and stiff. So you may be asking, are the crystals pretty shiny and pink? Is there a rave? A bunch of 20-year-olds high on E in my joints? I want to party, Mom. Can I? Mom, you never let me go. The answer is no. The crystals are stained for identification purpose, but wouldn't this be awesome? Thankfully, by eating healthier, patients can reduce the amount of flare-ups and slow the progression of bone destruction by taking medication to lower the uric acid production and by modifying their diet. Now I know it's hard to give up shellfish, lobster, beer, so good, and the other comforts, but it's for the sake of your body and not to look like this. On a serious note, this condition can be quite awful, constantly in pain, unable to move, and essentially become confined to a bed. Sadly, this condition is on the rise. About 4% of the US population has this condition, which equates to 8 million people suffering from gout. Quite impressive. Thankfully, I'm not affected by this condition, but my brother-in-law and sister-in-law suffer from this condition. Every time I hang out with them, they're always sore, slow to move, and now are having trouble walking. They're only in their 30s. I made this video to also educate myself and help my family members. There is hope, guys. At the end of the tunnel, patients can continue with their medications, but change their diet as well. And by modifying the diet, the amount of flares will reduce. In addition, if we lose weight, this will also reduce the amount of flares. Not weight loss, Dr. Sorella. No. Yes, I said it. Being fat is another cause of your medical issues. Yes, this means no alcohol, no red meats, no shellfish. This poor lad, his glass is empty. He's drinking his sorrows away just because he broke his arm, now casted. And the only way to reduce his pain is more cowbell. I mean, booze. If you guys want to make another video of me addressing the pain epidemic, the pharmaceutical abuse, comment below and I'll dive into another video. The moral of the story is your life is going to change for the better. Granted, you won't have the same fun and enjoy the nightlife like you had in the past. Look at these girls. They're totally having fun toasting to lemon-infused sparkle water. and still acting drunk so men can buy them more drinks, only to find out you are not going to be laid tonight. So the foods you should avoid are alcohol, obviously, high sugar rich drinks, processed foods, and refined carbohydrates. Reducing seafood such as lobster, shrimp, sardines, anchovies, tuna, trout, mackerel, and haddock. I personally did not know what haddock is and ended up down a rabbit hole on the complexities of haddock. Apparently, it's confused with cod, but the big distinction is the frontal dorsal fin. In cod, the fin is round, and in haddock, it's pointed. They taste the same cooked, but cod is a little bit fattier and less flakier. The biggest is the price. Cod is about $12.99 a pound, and haddock runs you about $14.99 a pound. Don't let restaurants rip you off, especially if they're promising you the haddock special. Cherries have some evidence to help reducing flares. Vitamin C can also lower the urate production, but it's very small. Coffee surprisingly can lower your uric acid production, but then again, the effects are small. My overall recommendation would be start medication with diet modification. You don't want to rely on diet solely alone and then have joint erosion and then start taking medications afterward. By then, it's too late. The bone has been destroyed. The purpose of treatment is to prevent bone destruction. Take this x-ray. See how the joint space and the big toe is destroyed and the bone has been remodeled? When this occurs, there is no turning back. Medications will not change this condition. Treatment options. You just drank a bunch of booze and had your lobster and now are in agonizing pain. What do? Sure, you could drink some more booze to ease the pain, but not the best advice. But it's great for drowning the emotional pain now that you have no Games of Thrones episodes to watch. All right, to treat the flare, I like to use colchicine. Other options are steroids like prednisone and NSAIDs like indomethacin. Ideally, the patient knows what's best for them given their prior flares and may tend to have an inclination for one treatment option versus the other. Other factors I consider: does the patient have any risk of bleeding? If so, I usually avoid NSAIDs. If they have underlying kidney issues, again, I avoid NSAIDs. If there's a potential infection plus a gout flare, I usually avoid steroids as this can blunt or weaken the immune system to fight the infection. Usual dose of colchicine is 0.6 milligrams 3 times a day on the first day, or initially taking 1.2 milligrams initially, and an hour later, 0.6. Essentially a total dose of 1.8 milligrams on the first day. Then this medication is taken once or twice a day until the flare resolves. Lastly, let's talk about maintenance therapy, essentially how to reduce continued flares. Ideally, by lowering the production and enhancing the clearing of uric acid, this will reduce the flares the patient goes through. Now, this section is way too complicated, requiring a pharmacy degree, but if you guys are interested, I can break it down for you in another video. Just leave a comment below if interested. Once again, thanks for watching. Click subscribe to be part of the community. If you have any medical issues, need clarification, or just want to chat to a doc, comment below. Take care.